So today we're going to learn about obstetric examination. So before we start obstetric examination, we should introduce ourselves to patient and those who are around us. So Puan, good morning. Saya Dr. Artu. Saya pensyarah kepada murid-murid tahun 5 ni. Kita nak buat satu pemeriksaan perut lah, kedudukan bayi dan sebagainya. Itu juga Puan. Kalau apa-apa masalah, beritahu saya lah. So first of all, we have to make the patient comfortable. We have to cover the patient until she's comfortable, exposed adequately so that we can see up to the symphysis pubis. Okay? And also up here, and make the patient comfortable by putting the hands on the side. After that, we wash our hands with sanitizer and keep our hands dry. If you're a male or even sometimes a female patient, when you examine, you need to have a chaperone. Can I have a chaperone, please? One, Aina, can you have chaperone me? Very good. Can you stand here? Very good. Thank you very much. So always say polite words. Thank you, and praise the patient or those surrounding us. Next, I would like to do inspection. On inspection, and make sure your coat is tied enough. You don't want anything hanging out and falling on the patient and disrupt your examination. And always inspect, examine the abdomen from top to down and see any scars anywhere. So once you have completed your inspection, then you can describe the findings. So on inspection, the abdomen appears to be distended with gravid uterus, which is signified by linea nigra and some holes striae gravidum. There is no obvious scar. The umbilicus is central and normal. I'd like to proceed by palpating the abdomen to see any tenderness. Puan, ada sakit mana-mana? Ya, saya katakan kalau ada sakit beritahu ya. Bagus. Okay kan? Nice. So abdomen is soft and well tender on palpation. Next, I would like to examine the symphysis fundal. Normally, I use the index finger. The edge of index finger is more sensitive. I go likewise to identify my fundus. So I could feel the fundus here. So I can use my weight measurement. You can measure from here to here or from there to here. It's up to you, whichever convenient for you. So and try to use the inches part so that we can not. So symphysis fundal height, and the measurement is about 28 weeks. She's at 32 weeks. The uterus is slightly smaller than the dates. Her dates is 32 weeks. The measurement is 28 weeks. Okay, next I would like to do a Leopold maneuvers to identify the position of the fetus. So there are 3 maneuvers. The fundal grip to locate the fundal, whether the buttock is at the fundus or the head is at the fundus. Here is look like some hardness on this side. It's more like a buttock here. And I'm going to turn this way and look for the leg. This is lumbar, fundal and lateral grip. Lateral grip again, I can feel some hardness here, which means probably the back is lying this way. And go down. The pelvic grip usually we go the other way around, and always look at the patient's face and don't press too much because she got placenta previa. We don't want to hurt or cause any bleeding. I could feel some hardness here, which means it's more like a head here. So the head is cephalic in presentation. It's floating, and see the head is not engaged, floating, and the back is lying this way. The back is lying to the maternal left. So on presentation, I could feel a fetus, which is a longitudinal line, in cephalic presentation with the fetal back on the maternal right, left. Next, I would like to see whether the likewise adequate. you just shake here a bit. I can see the baby is moving nicely. A lot of ample of likewise adequate. You can also underestimate the fetal rate. Roughly when it's about 32 weeks, the fetal rate will be around 1.2 to 1.5 kilos. So I like to complete my examination by auscultating the fetal heart using enough. So I can do that, or I can use adapter to identify the fetal heart. With that, I've completed my examination. So thank you Puan. Very tolong untuk saya. Terima kasih. And now quick follow the same steps.